telemedicine is here. It's actually not that new to begin with, but it's here. And there's a few factors that have really been driving the rise of telemedicine. So let's just start with the most obvious one, and that's really technology itself. You mentioned a smartphone. We're talking smartphones, computers, the whole gamut of technology. And now that we are so much more connected, now that we have wireless connectivity, now you're really starting to see the adoption of telemedicine just start to take off.
Right, because we have these devices that allow us to make that quote unquote personal connection with the person on the other side of the device, where I think a lot of people might, before either didn't have, a smartphone in their pocket or were just leery of technology. I think technology has become so commonplace that even people who were late adopters now can actually use these things and gain value out of them. I think that evolving technology is going to continue to be a big driver of adoption of telemedicine. I'm sure we'll talk about some of the struggles or obstacles in the way of it. But I think one of the other really, really big trends that people need to be thinking about here when it comes to telemedicine's opportunity is just a larger, increasingly longer living population. I mean, aging baby boomers, they're turning 65 at a rate of, I think, 10,000 people a day. And by 2035, the population of people who are over 65 in the U.S. will outnumber the population of children for the first time. So we have got this huge population of people who are getting older, and those are the biggest consumers of healthcare services, the elderly.
And it's interesting because, of course, the obvious driver of technology, you don't immediately then think, now the elderly are going to be a huge driver because of the technology. But you're exactly right, Todd. Even more so when you think about it from nursing facilities and skilled nursing facilities, that is actually one of the fastest growing segments in terms of using telemedicine, but it makes so much sense. Studies show that approximately 60 to 70% of all nursing home transfers to the hospital are just flat out unnecessary. In one particular study, it was actually done in 2015, found that an off-hours telemedicine service prevented over 90 hospital admissions or readmissions over the course of a year. And this was for a 360-bed facility based out of New York. The savings were over $1 million in Medicare cost alone. And of course, just improving the clinical outcomes for these patients as well. So I'd say even more so than the technology is the fact that we've got this aging baby boomer population really driving it too.
Yeah, I think one thing that we don't have to worry about when it comes to the healthcare industry is demand, right? The demand side of the equation is not going to be a problem. I think the real problem is going to be supply. And part of that supply problem is going to be being able to deliver it cheaper and more conveniently. And that's to your point, the ability to, I guess, reduce unnecessary visits that can tamp down on spending. That's huge, especially when you're talking about a patient population that has such a big need for healthcare. I saw a statistic, Shannon, said that of Americans who are over age 50 today, and there's roughly 70 million of us out there, 4 out of 5 of us have at least one chronic condition. But anyone who's above 65, nearly 9 out of 10 has a chronic condition. I mean, it is truly a big driver of healthcare spending. Aging America is a big driver of healthcare spending in the country today. We spend 4 times more on caring for the elderly who have chronic disease than those that don't have a chronic disease. And part of that is because of things like, unnecessary visits to the ER.
Absolutely, which, also brings up a good point in terms of the physician shortage. This has been an ongoing issue, Todd, for quite some time. I think as you think about the astronomical numbers of people just with chronic conditions, especially as we age, what becomes even more concerning is that we may not have enough physicians to meet the actual demands. And so let's actually dive into that, because there's some really fascinating stats with that too.
Yeah, I mean, they call them the medical deserts, right? I mean, it's just, think about it this way. All of us are getting older, right? Including the doctors. And there are about 1/3 of the doctors who are out there are baby boomers who are going to be coming up on retirement themselves. As I was going through and prepping for the show today, Shan, I discovered that there are over 1 billion visits to either primary care offices or hospital outpatient visits every year. 991 million to primary care offices alone. And if you think about, the fact that, we've got this tremendous amount of demand coming through the pipeline, and this potential for so many doctors to retire, you could have a massive shortage. Matter of fact, the Association of American Medical Colleges, their estimate right now is that I think by 2030, something like that, we're going to have a shortage of about 49,000 primary care physicians. And that equates to having, I think, 62 million people in the United States that are inadequately served because of these physician shortages. So yes, that's a huge, huge problem. And again, we've got to find new ways to boost healthcare supply, especially if we want to move the needle on cost.
Absolutely. Which brings us to the point of where the limitations are with telemedicine. The opportunity, the need is tremendous, but it doesn't necessarily mean that telemedicine has it all right now, Todd. So in particular, there are a couple of barriers that telemedicine still needs to overcome. One of the biggest hurdles, and what has really, I think, been one of the things that has slowed it down the most, has been on the reimbursement and regulatory end of things. So for example, just even defining what telemedicine is still a work in progress when it comes to reimbursement. Obviously, for payers, they want to be able to narrowly define what is telemedicine, how do we code for it, how do we pay for it. That term is still broad. So until we get more traction on what it is, I think that's the first thing. There was obviously too some legal concerns because, of course, if you're treating someone via telemedicine and something were to happen to that patient, and because you weren't actually physically examining them in the office, obviously insurance companies weren't too keen on that. But what you've seen actually in 2019, we are starting to see a shift. There were some actually big moves on the regulatory and legislative front to really remove some of those barriers, both on the payer and the health plan policy side. What's, I think, interesting for me in that front is you are starting to see a shift. Granted, it's slow, but telemedicine is shifting away from this kind of standalone service that's separate from and apart from your typical insurance, your typical healthcare. And now it's actually being integrated into the existing healthcare system. So I think that is certainly a positive on that front. And I think we're getting there. Still a long way to go on that front, though.
The how to pay for it issue is a big one. And I think that has been a big obstacle to adoption because, the last thing you want to do is tell a patient now, hey, guess what? We have something else that you're going to have to buy, right? One of the ways that they're overcoming that objection is that they're coming up with business models where the telemedicine company will actually sign a contract with the employer or the health insurance plan and receive a fee based upon the number of members they want to cover with telemedicine. So the payer is actually footing the bill, if you will, for providing access to telemedicine. I think that has really, really been a big driver of some of the growth that we've seen through the industry the last few years. I was reading somewhere that I think we're up to, of the large companies, the largest employers in the country now, we're up to about 74% of them offering telemedicine services to their employees. So listeners, if you don't think you have telemedicine and you work for a big employer, you may actually have access to telemedicine. It's definitely worth looking into, especially if you're interested in the convenience and potentially a lower cost depending on what your copay happens to be. You mentioned the regulatory side of things. Yes, that's been a problem because you've got to have states actually agree to what the definitions are, and then they need to figure out, okay, well, we're going to allow a doctor in, say, Massachusetts to be able to treat a patient in New Hampshire? Will they have to get licensed in New Hampshire as well? How are you going to handle that or address that kind of an issue? Obviously, the best way would be to have almost like a national registry or something like that, so that, you have a slow doctor's office in, say, Utah, and they can be able to, they have the extra capacity in their workday to be able to see more patients. So maybe then they could be seeing, people in a very, in an area where there's a tremendous amount of demand and that's underserved. So I think that those are some of the other considerations that we're trying to figure out, the growing pains, if you will, in getting telemedicine to become something that's much more commonly used by people.
Exactly. And even too, just on a logistical front, Todd, you're recognizing that for these types of visits, these are non-emergency visits. These are for things like, a cold, the flu, things that don't require immediate care and are non-life-threatening. So, of course, that's certainly a limitation. I don't think that will ever change. But all in all, I do think that telemedicine represents a huge opportunity. I think we're just seeing the beginnings of what telemedicine will look like. And we'll get into some of the stocks and kind of what they're doing to go after some of the opportunities there. But that's just to say the future of telemedicine does look quite bright, Todd.
Yeah, absolutely. And, I wouldn't shortchange it. I mean, I think that, you saw one of the companies we're going to talk about later on has moved much more into specialty care over the course of the last couple of years. I think that as technology gets better and we're able to do a lot more in the way of remote monitoring, and who knows, right? Maybe someday we'll actually have holographic images where our doctor is actually standing in front of us and able to evaluate us in our living rooms, right? So I wouldn't count technology out as far as being able to kind of break through some of those technology barriers and get us to a point where telemedicine is helping more complex cases. But to your point, we're still a long ways away from that.
I don't know about a hologram. I think about like my mother, who actually still refuses to use on her phone the banking app just for security concerns. Could you imagine having a hologram in your living room? I don't know how open people would be, but I do think that's where we are headed. Eventually, we'll get there.